Okay, class, we're on page 211. We're looking at the muscles of the hip joint. We're going to start with the hip flexors, the iliopsoas, and the rectus femoris. Please remember that iliopsoas is more medial, so we're going to ask the patient to bring her knee up, and we're going to find right up the hip two tendons. One here, the medial one, the iliopsoas, and one a little more lateral, the rectus femoris. Next, we're going to ask our subject to lay on her back, please, on the ground. And we're going to look at the serratorius. So to look at this, the serratorius is responsible for hip flexion, abduction, external rotation. And we're going to follow the ASIS right across to the medial aspect of the knee where it comes in to form part of the pes anserine. Next, we're going to ask the patient to lay on her right side. So roll over to your side. And we decided we're going to cluster all of the hip adductor muscles into one. So I'm talking about on page 212, the pectineus, gracilis, adductor magnus, adductor longus, and adductor brevis. We'll ask the top leg to move out of the way, and the patient lifts this leg up and holds it in the air, and we'll find the adductors along the middle of the thigh here. If the patient could roll onto her belly, please. Other belly. We're going to find the glute max. To do this, subject's going to bend their knee and lift their knee off the ground, and the glute max is right here. The next one we're going to look at is the hamstring muscles. The hamstrings, of course, are hip extensors and knee flexors. So we're going to ask the patient to resist knee flexion, so don't let me pull your leg, Ellie. Good. And we could see immediately pop up here is the semitendinosus muscle, more medial, the long, thin, stringy one. And medial or lateral to that, you may find the semimembranosus. In this case, it's a little more narrow, more medial. You could feel here. And the lateral aspect is the lateral hamstring, the biceps femoris. There is no hamstring tendon in the middle of the back of the knee. And then finally, if we could ask our subject to lay on her side facing the camera, please. Remember, we found the greater trochanter a little earlier here. To find the glute medius and glute minimus, we're going to ask the patient to abduct her hip and hold her leg up in the air right here. And we're going to come just posterior to the greater trochanter, and we're going to find glute medius, glute minimus, and then again, coming down the front and the side of the leg here is the tensor fascia lata.